think the biggest challenge would be the time commitment required in addition to the money it takes to implement a solution up front, and the money it also incorporates the resources that you need to have, whether it be consulting resources or hiring people in addition to your current staff, or you may have to use staff that you have that are doing other functions like an office manager or maybe a clinical person to learn the system. So and then culture. So you also have to deal with the fact that you have older physicians who have never used systems before in their lives. They are not very comfortable moving to an electronic environment and changing the way that they currently practice. And I think until they are either shown or taught by a colleague that they have respect for, or who has gone through either they're in the same situation that they are, or they've gone through it already, it's going to be very difficult to get some of that older generation physician population to upgrade into an electronic environment. Well, I think the biggest thing is depending on the type of organization that you are. So if you are a large hospital organization or a multi-specialty physician group like Manhattan's physician group is, it's a little bit different as opposed to an organization that's maybe a 2 or a 3 doctor practice. So if you're a large organization, it has to start from the top, and that top needs to be executive and clinical leadership saying this is the direction that we're going to move in. They then need to bring on the clinical leadership teams at the departmental level to be part of that process in terms of buying into the new system, as opposed to if you're a smaller group practice and you may just not have that familiarity with an electronic system. So you're kind of off and on your own. You're on your own. You're trying to find out what's the best system for me. You may be very overwhelmed. And that's why it's always good to have a support network, and I think what the federal government is doing with funding the regional extension centers to assist some of these smaller physician practices will go a long way in helping them adopt information technology, but really just holding their hand and saying, we're here, we can provide the necessary resources for you in terms of information and making you and allowing you to make the correct decision that works for your practice. Again, it sort of depends on the type of organization that you are, but I think the one that I look at the most is the independent or the small group practice. And as I said in the panel discussion earlier today, I firmly believe that the biggest deterrent is fear or uncertainty. You've never been in an environment like that. You have been practicing for however long. You have been in the same current state using a paper chart. You're very comfortable with that, and now all of a sudden they're saying you need to get onto an electronic system. If you don't get on in a certain period of time, you may not receive some funding to help offset some of the cost. So I think the biggest deterrent, in my opinion, is fear. I've seen that with our pediatrician. I've seen that with my wife's orthopedist. I don't think cost is the issue, because I do believe that if you were to say, this is a solution that could work for you, it's not a very large cost, it will take some time away from your practice, I still think the biggest deterrent is, I've never done this before. It's no different than, taking a leap of faith in anything that you do. It really comes down to that, I think. In addition to an electronic medical record system, whatever system it may be, I firmly believe the biggest push in the next 5 to 10 years is going to be from the patient level. The patient is going to require that their physician is in communication with them, their physician is making them an active participant in their care. So when you talk about patient portals, where it's through the electronic medical record vendor, where they allow you to see lab results or to request a referral or to electronically renew your prescription, or whether it be integrating with some of these public health records that are out there. You have WebMD, you have some Google application, you have Microsoft, and then you have many other applications. Patients are now moving to some of those applications, which means that the EMR vendor is going to have to help support some of that. And I think that's one of the best places to spend money, is because the push is going to come from the patient. But I also think that when you do have an EMR system, there are a lot of good tools out there that help make your life a little bit easier. There's a very good quality tool called IMO, which breaks down intelligent medical objects, which breaks down the way that a physician looks for a problem list and gives them additional secondary coding, additional descriptions about the diagnosis that make it a little bit easier when a patient comes in with problem A. Well, in addition to problem A, you may want to look at these, secondary and tertiary problems that typically accompany problems with patients that have these initial problems.